I'm Dr. Jonathan Deong Kee Kong, Consultant ENT Surgeon in Penang Adventist Hospital. Sleep apnea is a sleep disorder characterized by abnormal cessation in breathing, on and off, repetitively during sleep. Each cessation in breathing may occur more than 10 seconds or even more than a minute is called an apnea. This disorder is increasingly becoming more common nowadays due to the lack of physical activities in this modern era, paired with the rise of highly stressful living environments.
To talk about what are the causes of sleep apnea, firstly, we have to divide it into three types of sleep apnea. Obstructive sleep apnea, central sleep apnea, mixed sleep apnea with the feature of both. Obstructive sleep apnea is the most common form. It develops when there is a blockage of the upper airway. Air has to go from the nostril into the back of the nose called as nasal air passage, then enter into the throat and travel further down through trachea into lung. Somewhere along the airway, there might be a blockage in the airflow. Allergy might cause soft tissue swelling in the nose, or any growth like nasal polyp, nasal tumor, or deviated nasal septum cause nasal blockage. Or there might be swollen adenoid gland, or tonsil or soft palate hypertrophy lead to airway obstruction. There might be a severe overbite which pull the jaw back and block the airway. In individuals that are overweight, there could be too much soft tissues of the neck which can weigh down the airway, especially when a person is lying down. These problems are very obvious at night because hormonal changes at night can cause the muscle around the airway to become slightly less stiff while sleeping. This means that they are less able to keep the airway open, making it more likely to get a big squeeze or obstructed.
Causes of obstructive sleep apnea: obesity, when there is an excessive weight; neck circumference, is the patients have a thick and very short neck; narrow upper airway; old age, especially more than 65 years old; male, genetic or family history; chronic alcoholic or chronic smoker.
Central sleep apnea refers to the fact that the problem is central or related to central nervous system. This is where the brain intermittently stops making an effort to breathe for 10 to 30 seconds. The apnea can persist for several seconds even after waking up, triggering feeling of panic and further disrupting the sleep cycle. Central sleep apnea starts with an initial episode of hyperpnea, which is the brain direct the lungs to ventilate to increase the respiratory rate. The rapid breathing causes hypocapnia, fall in the blood carbon dioxide level. When the carbon dioxide level falls below a certain threshold, the body slips into apnea state, making no effort to breathe and taking in no oxygen. As the apnea persists, this causes the carbon dioxide levels rise back to normal levels and then keep rising to which is called hypercapnia. The high carbon dioxide levels trigger hyperpnea again and the lungs start hyperventilating, hence the cycle repeats again.
Mixed sleep apnea, when obstructive sleep apnea becomes severe or long-standing, central sleep apnea will set in and it will develop mixed sleep apnea. It can be presented with daytime and nighttime symptoms. During the night, patients with sleep apnea may have very loud and persistent snoring during sleep, pause in breathing, intermittently witnessed by sleep partner, bad dreams, feeling of suffocation, and interrupted sleep pattern due to frequently waking up. During daytime, they may manifest with early morning headache, throat dryness, fatigue, reduced in stamina, poor concentration, and mood swings. In the early stage, your sleep partner will tell you. In the late stage, when severe complications such as raise in blood pressure, irregular heartbeat, heart failure, and diabetes, it will start to set in. It will alert you to seek for medical help. The standard way of diagnosing sleep apnea is by using a polysonogram or sleep test.
Polysonogram or sleep test is a device that to monitor your brain movement and activities, oxygen and carbon dioxide levels, blood pressure, heart rates, snoring and breathing patterns, eyes and legs movements during sleep. It will tell you either you are having obstructive sleep apnea, central sleep apnea, or mixed sleep apnea.
For mild cases or those in early stage, we will advise them to correct the reversible risk factors such as weight loss, control the diet, exercise, stop smoking and alcohol, abstain from taking sleeping pills or antidepressant drugs, sleeping sideways, or with the use of medications such as nasal spray, nasal decongestant, or antihistamine to overcome the nasal blockage. In moderate cases, we will advise for surgery to correct any anatomical obstructions. If inoperable, the use of CPAP machine can be considered. However, in severe cases, CPAP or APAP machine plus minor using the surgery is a standard treatment. Nasal surgery to correct the deviated nasal septum, nasal turbinate trimming and removal of nasal polyps. Or throat surgery to remove enlarged tonsil or adenoid. Palatal surgery like U3P, we call it as uvulo-palato-pharyngoplasty, or base of tongue advancement with mandibular adjustment, pillar procedure, and etc. By CPAP machine or APAP machine, or we call continuous positive airway pressure or automatic positive airway pressure. These are equipment to generate pressure air into the throat to keep patient's airway open. Either machine is a standard treatment for central sleep apnea. If someone were to tell you that you snore or intermittently stop breathing during sleep, you should start to reflect whether your lifestyle is in a healthy way or not. Otherwise, start taking necessary action to practice healthier lifestyle, and hopefully this will help to reverse the sleep disorder. If you notice yourself experiencing any of the above symptoms as mentioned, I would advise you to consult an ENT specialist to assess your condition and manage them before it is too late and end up with heart failure, heart attack, or stroke.